Hello friends, welcome to my YouTube channel. Today, let us learn the mandible. So here we have the mandible. The mandible is a U-shaped bone forms the lower facial skeleton. The mandible is the largest and the strongest bone of the face. It forms the skeleton of lower jaw. What are the features of the mandible? The mandible has got a body. This is known as the body of the mandible. And this here we have the ramus and it has got some process. So here we have the coronal process. This is the condylar process. And this particular part where the teeth present is known as the alveolar arch. And here this is the base of mandible. This is the body of the mandible. The body of the mandible has got two surfaces. There is an external surface and there is an internal surface. And the two borders, superior border is known as the alveolar arch and this inferior border is known as the base of mandible. And if we see here external surface of the mandible, in the midline you can see there is a crest like structures and a triangular area. Okay, so this faint ridge present here is known as the symphysis mente. Symphysis mente. This symphysis mente indicates the line of fusion of two halves of mandible. So mandible develops by two halves. Later, these two halves fuses along this line represents the symphysis mente. There is a triangular area below this symphysis mente. You can see here this triangular area is known as the mental protuberance. Mental protuberance. And this mental protuberance has got two tubercles here and these are known as the mental tubercles. Again, if you examine the external surface of the body of the mandible, you can see there is a small foramina. So this foramen is known as the mental foramen, which is situated just below the second premolar teeth. This is the mental foramen. And mental vessels and nerves are passing through this mental foramen. And here we have the incisor teeth. There is a shallow depression present below the incisive teeth is known as the incisive fossa. Incisive fossa. And mentalis and orbicularis oris muscle originates from this mental fossa. And you can see there is an oblique line. There is an oblique line extending from the anterior border of the coronal process. Three muscles takes origin from this oblique line. They are depressor labii inferioris, depressor angulae oris and vaccinator. Now let us see the features of internal surface. If we examine the internal surface of the mandible, there is again a line. That line is known as the mylohyoid line. Mylohyoid muscle takes origin from the mylohyoid line. And area present below this mylohyoid line is known as the submandibular fossa. Posto-inferior to this mylohyoid line, this area is known as the submandibular fossa. Here we have the submandibular salivary gland. In addition to submandibular salivary gland, we have facial artery and submandibular lymph nodes are also present in this submandibular fossa. And area above known as the sublingual fossa, we have the sublingual salivary gland over here. Then here we can see four tubercles are there, and these four tubercles, that is upper two and lower two, these are known as the genial tubercle. Genial tubercle. And upper two genial tubercles gives origin to genioglossus muscle, and the lower two genial tubercle gives origin to geniohyoid muscle. Then I told you this is the mylohyoid line. The posterior most part gives origin to superior constrictor of pharynx. Superior constrictor of pharynx. Body has got two borders, upper border and lower border. So this upper border, I already mentioned that it is also known as the alveolar arch. So here you can see we have the sockets for the lower teeth. Sockets for the lower teeth. Then here is the lower border of the body of the mandible. It is also known as the base of mandible. Base of mandible. If you see the base of the mandible, on either side of the midline, two depressions are present. So these two depressions are the digastric fossae. We have the right and left digastric fossae. Anterior belly of digastric muscle takes origin from the digastric fossae. Now let us see the details of ramus. This is the ramus of the mandible. The ramus of the mandible has got two surfaces. There is a lateral surface and there is a medial surface. The posterior aspect of the lateral surface is related to the parotid gland. Here we have the parotid gland. And remaining area is occupied by the masseter muscle. Okay. Now let us see the medial surface of the ramus of mandible. Medial surface of the ramus of mandible, there is a foramen. You can see there is a foramen. This foramen is known as the mandibular foramen. Mandibular foramen continues as the mandibular canal. And what structures are passing through this mandibular foramen and mandibular canal? That is, inferior alveolar nerves and vessels are passing through this. Inferior alveolar vessels and nerves are passing. So inferior alveolar nerve is a branch of mandibular division of trigeminal nerve, whereas the inferior alveolar artery is a branch of maxillary artery. And along this margin, you can see there is a tongue-shaped projection. Margin of the mandibular foramen, there is a tongue-shaped process that is known as the lingula. And the lingula gives attachment to a sphenomandibular ligament. From the lower part of the mandibular foramen, there is a groove that is known as the mylohyoid groove. Mylohyoid groove. Mylohyoid vessels and nerves are passing through this groove. And what are the borders of the ramus? Okay, so it has got an upper border, lower border, anterior border, and posterior border. The upper border, it is thin and it forms a notch-like structure that is known as the mandibular notch. Mandibular notch. So what structures are crossing this mandibular notch? We have the masseteric vessels and nerves are passing through this. The lower border meets the posterior border. This particular point of meeting is known as the angle of the mandible. And again, it has got an anterior border. This is the anterior border. Anterior border is continuous above with the coronoid process of the mandible. The temporalis muscle is inserted onto the anterior border and the medial aspect of the coronoid process. Posterior border is continuous above with the condylar process. Condylar process. The condylar process is the head of the mandible and area below is known as the neck. The head of the mandible is articulated with the mandibular fossa to form the temporomandibular joint. Anterior aspect of the head of the mandible, there is a depression that is known as the pterygoid fovea. Pterygoid fovea, which gives insertion to lateral pterygoid muscle. And the neck, medially, the neck is related to auriculotemporal nerve and maxillary artery. Two structures are related onto the medial aspect of the neck of the mandible, that is auriculotemporal nerve and the maxillary artery. And the lateral part gives attachment to lateral ligament of temporomandibular joint.